Ciprofloxacin, or Cipro, is a monumentally important antibiotic that has played not only an essential role in tackling a wide range of infections, but also is prepared to keep the United States safe against some forms of biological warfare. Throughout this presentation, we hope, as chemists, to explore with you the structure, function, and broader societal impact of the blockbuster drug ciprofloxacin. We hope to give it depth, provide insight, and perhaps spark appreciation for those who contributed to the discovery. First, the journey begins in 1963 when Carl Metzger joined Bayer Pharmaceuticals, and then ends with current projections of massive prescription and profit booms for Cipro in the upcoming years. Each major event posted in this timeline will be investigated in more detail in the subsequent slides. Dr. Carl Metzger was the first chemist to join Bayer Pharmaceuticals as a molecular biologist in 1963. His career consisted of prolific research and discovery of some of the most prominent antibacterial drugs, but Cipro provided the most high-profile story under his name. When he filed the patent for Cipro in 1980 after working on the synthesis with Klaus Groh, it was not clear how quickly and effectively it would sweep the market in the coming years. 7 years later, when it hit the market, it took by storm and continues to be to this day well within the top 200 most prescribed drugs. Most years, it well surpasses 6 million prescriptions. What makes it unique is its versatility. It is what is known as a broad-spectrum antibiotic, and so can treat multiple bacterial infections in a plethora of regions in the body. It is highly effective, but non-specific. It can be used to treat any of the infections listed here, and many more. What brought Cipro to the forefront of the public's eye was not necessarily its versatility as a treatment for the listed infections, but rather for its life-saving activity against the 2001 anthrax attacks, and against anthrax attacks in general during the Gulf War. The fatal respiratory inflammation and infection that categorizes anthrax is caused by bacterial spores, oftentimes so small that they cannot be seen. When letters containing such spores were sent out in 2001 after the 9/11 terrorist attacks, those who stumbled into the ER were treated with Cipro, most of which were saved due to its treatment. Bayer gave the United States 100 million tablets at a reduced price of 95 cents each to protect citizens from anthrax. Dr. Ken Ellebeck, a defected Soviet biological warfare specialist, grew concerned with the number of prescriptions and the widespread general use of Cipro on anthrax. His specialty was crafting strains that were resistant to the treatment, and mentioned the effectiveness of the United States stockpile of Cipro may become useless if it continues to be used and more resistant strains begin to surface. As of now, however, the government has enough Cipro stocked to supply 12 million Americans with a 5-day supply of the antibiotic. To demonstrate the severity of anthrax and how important Cipro is as a treatment for the biological weapon, Dr. Ellebeck gave a short presentation on the U.S. preparedness for biological attacks and mentions anthrax as being a serious and effective threat.
Melioidosis, very efficient. Anthrax, unbelievably efficient because of very high stability in environment in aerosol. I was responsible for developing this industrial process in 1985, 1987. And I can say stability of this weapon is unbelievable. If a territory is covered by anthrax, of course, it's very difficult to contaminate this territory. You know, we had one more example, a real example of applying biological weapon on the basis of anthrax. A situation when the Soviet Union applied biological weapons against its own population, but fact is fact. And amount of people who have died, of course, nobody knows, and nobody would know in the future the real amount of killed people. But we can say about 100. But what it showed that if a set of symptoms appeared, practically no chance to treat the disease.
Cipro is extraordinarily effective for bacterial infections and is rated by the WHO and the CDC one of the top essential drugs, given its extreme safety. Projections show a new boom in the prescriptions of Cipro from 2019 to 2027, given its possible link to COVID treatment. Hydroxychloroquine is of the same quinolone class of drug as Cipro, and thoughts of its general treatment ability have projected a future boom in the prescription numbers.
Have the structure of Cipro. It has a molecular weight of 331.35 grams per mole, an estimated log P of 1.32, 2 H-bond donors, and 4 H-bond acceptors. It therefore more than satisfies Lipinski's rules of 5. And also, please note that the fluorine is technically not an H-bond acceptor because of the decrease in polarity between the FC bond when it's a fluorobenzene. Belongs to a class of antibiotics known as fluoroquinolone antibiotics, which are all derivatives of the molecule 4-quinolone. The first quinolone antibiotic was nalidixic acid. Nalidixic acid is considered to be the precursor to all 4-quinolone antibiotics, despite not technically being a 4-quinolone derivative itself, because it has the extra N. It was first released in 1962, where it had substantial success with treating urinary tract infections. A variety of structurally similar antibiotics were subsequently synthesized and released using 4-quinolone as a template, resulting in a second generation of quinolone antibiotics known as fluoroquinolones due to the addition of a fluorine. Second generation quinolone antibiotics, of which Cipro is a member of, contain the structural modification shown on the right. As you may have noticed, the structure of 4-quinolone antibiotics bears a striking resemblance to many of the nucleic acids that make up DNA, and this speaks to its mechanism of action. For 4-quinolone antibiotics is drastically different from other classes of antibiotics, and in particular beta-lactam antibiotics. Unlike beta-lactam antibiotics, which target the exterior of bacteria, quinolone antibiotics destroy a bactericide from the inside out by hindering DNA replication. In particular, 4-quinolone antibiotics target DNA topoisomerase II enzymes, which are responsible for relieving the coiling tension in DNA to prep it for replication. Topoisomerase enzymes function by alternating between a relaxed state and a tense state once it is bound to the DNA strand of interest. Quinolone antibiotics bind to the topoisomerase I DNA complex and stabilize the relaxed state by forming pi-stacking interactions with the bound nucleotides. This is why the 4-quinolone base is so important. As a result, the enzyme cannot sample the tense state and therefore loses its function, preventing DNA from replicating. And if DNA cannot properly replicate, the cell dies. Now, 4-quinolone antibiotics are designed in a particular manner where they only harm bacteria DNA replication and have no effect on human DNA replication. The Carbonyl group in quinolone antibiotics and Cipro acts as a bidentate ligand capable of coordinating to magnesium 2, which is a cofactor of DNA topoisomerase. The additional aqua ligands on the resulting magnesium complex can form hydrogen bonds with nearby serine and glutamine residues. This perfectly positions Cipro to interact with the DNA strand bound to the topoisomerase. Now, what's important is that topoisomerase enzymes in human cells lack these glutamate and serine residues. As a result, Cipro is incapable of binding and positioning itself to harm the overall enzyme's functionality. Therefore, Cipro does not interfere with human DNA replication, although it does harm bacteria DNA replication. Discussed how quinolone antibiotics function as a whole and how they interact with DNA topoisomerase, I'm going to discuss the key structural motifs of ciprofloxacin itself. As previously mentioned, the dicarbonyl group on Cipro acts as a bidentate ligand that is capable of coordinating to magnesium ions found in DNA topoisomerase enzymes. The replacement of a hydrogen with the fluorine on the aromatic ring allows Cipro to largely bypass the first-pass metabolism effect in the liver, thus affording it increased bioavailability. Next, we have a piperazine ring, which is a common motif in numerous pharmaceutical drugs as well as recreational drugs. The piperazine ring reduces antibiotic resistance, but also increases uptake in the central nervous system. As a result, common side effects of Cipro are neurological effects, such as headaches and seizures. And finally, we have the cyclopropylamine, which is arguably the most intriguing feature of the molecule. The increased P character of the sp3 hybridized bonds, or banana bonds as they are sometimes called, in the cyclopropyl ring draws electron density away from the nitrogen, thereby drastically improving lipophilicity. So the main question is, how do all of these features allow Cipro to perform better than previous quinolone antibiotics, mainly nalicylic acid? Well, the primary thing is increased lipophilicity and better bioavailability. The main problem they had with nalicylic acid is that it would be quickly eliminated in the urine. As a result, it could only be used to treat urinary tract infections, whereas Cipro can be used to treat a wide variety of bacterial infections. Gone over the structure and function of Cipro, I will discuss how the drug itself is synthesized. I have shown here the original synthesis of Cipro performed by Klaus Grohe at Bayer, while Metzger would eventually go on to develop and patent a different synthesis for Cipro. This scheme nevertheless represents the first successful synthesis of Cipro and has some really interesting chemistry in it. In particular, I will be focusing on the first two steps, as the underlying mechanisms of these steps have some fairly interesting enamine chemistry. The last two steps are fairly simple nucleophilic aromatic substitutions. The synthesis, we have an enamine condensation, which is the nucleophilic addition of this enamine to this acyl chloride. Now, an enamine can be thought as the nitrogen counterpart to an enol ester, as we have this amine bonded to a double bond. Now, enamines can be drawn with a resonance form, which has an iminium ion here at the positive charge, and the beta carbon acquiring a lone pair and therefore a negative charge. As a result, this beta carbon is fairly nucleophilic and can perform nucleophilic addition to the electrophilic carbon of this acyl chloride. Once this happens, we follow through a typical nucleophilic acyl substitution mechanism, with the base in this case being TEA, which is a fairly bulky base.
So now that we've talked about the biological, the biochemical, and the chemical aspects of ciprofloxacin, I wanted to take some time to talk about how ciprofloxacin affected the world as a whole on a global scale. And in my research, I found a lot of stories that dealt with how Cipro affected the world, economically, medicinally, even in terms of war. But the two stories that actually stuck out to me were ones dealing with the Persian Gulf War and with the events that occurred shortly after the 9/11 attacks. In case you don't already know, the Persian Gulf War was a conflict triggered by Iraq's invasion of Kuwait on August 2nd of 1990. And after this occurred, the UN sent many nations, including the US, to Iraq in attempts to deal with the ongoing situation. And during this year of military conflict, Iraq actually threatened all the soldiers with anthrax. They said that they would invoke biological warfare unless the UN nation surrendered. Fortunately, upon hearing this, the US actually supplied all the soldiers with ciprofloxacin in an attempt to ensure that the soldiers would be safe if the threat were true. Because anthrax, while we do have treatments for it today, if it's left untreated, which is likely to happen in the middle of a war, it can lead to death. And I chose this story because it reminded me of how penicillin played a very important role in World War II. Without penicillin, millions of people would have died, and the war could have had a different outcome. In this case, of course, the war is on a smaller scale, but ciprofloxacin still played a role in helping the soldiers fighting the war. It made them safer,